Hi everyone, this is the second activity of this workshop, Learning Experience Interaction, my first learning dialogue. As a part of this activity, today let's see about nephrotic syndrome. It is a disorder which is related to the renal system, which means this disorder is related to the kidneys. So it is a syndrome which is characterized by proteinuria, hypoalbuminemia, edema and hypercholesterolemia. So you all know what is a syndrome. A syndrome is a group of symptoms, you call it as a syndrome. So nephrotic syndrome has a peculiar group of symptoms, which is proteinuria. The protein excretion is greater than 3 grams per 24 hours. Normally, we don't excrete protein in the urine. But in case of nephrotic syndrome, the amount of protein excreted is more than 3 grams. So what is the protein which is getting excreted is albumin. So when albumin is getting lost, you go in for hypoalbuminemia, which is decrease in the level of albumin in your serum. That is less than 3 grams per dl. And next comes is edema. So when there is proteinuria, automatically there is accumulation of salt and water which leads to edema. And hypercholesterolemia, that is increase in the cholesterol level where the liver tries to compensate for the proteinuria. And next we'll move on to the causes. The causes are mainly because of the primary glomerular diseases, which means the glomeruli is getting affected, which includes membranous nephropathy, focal segmental glomerular sclerosis, minimal change nephropathy, and membranoproliferative glomerulonephritis. Membranous nephropathy is the membranes are getting affected, membranes of the glomeruli. And the focal segmental glomerular sclerosis, that is a segment of the glomeruli is getting affected. Minimal change nephropathy. So because of some changes in the nephrons and the glomeruli, there is a minimal change which leads to a condition of nephrotic syndrome. And membranoproliferative glomerulonephritis, which means the disorder is getting proliferated. There is increase in the rate of affection. So when all these are called to be as primary, which means the disorder is primarily affecting the glomeruli. At this point, let us have a reflection spot. Can you think of other condition where you have edema, proteinuria, which is related to renal system? When you get the answer, please resume. Yes, you are right. Most of you have answered as acute glomerulonephritis. What is acute glomerulonephritis? That is sudden onset of hematuria, proteinuria and RBC cast. That is, the symptoms in acute glomerulonephritis includes hematuria, proteinuria and RBC cast, which is diagnostic of glomerular bleeding. So when the glomeruli is getting injured secondary to any of the diseases, you go in for hematuria, which means blood in the urine. and RBC cast, that is the RBCs are getting shedded. And you also have a characteristic feature of coke colored urine. The cool drink which you consume, the coke, so your urine in acute glomerulonephritis mimics the same, and edema in the later stages. So how do we differentiate this? Based on the clinical examination, and renal biopsy also helps to differentiate between a nephrotic syndrome and acute glomerulonephritis. In acute glomerulonephritis, you will not have edema in the initial stage, but only in the later stage you may be having this edema. Let us see about the clinical features of nephrotic syndrome. That is puffiness of the eyes, edema of the legs, face, hands, scrotum, weight gain, decreased urine output, increase in the specific gravity of urine, loss of appetite, and gastrointestinal changes, either in the form of constipation or diarrhea. You may also go in for ascites. So having all these in mind, let's see about what is the dietary management. So along with your medical management, as part of nurse's role, we need to care much about the dietary management. So when caring for a child with nephrotic syndrome, dietary advice need to be given as part of our nurse's role. So dietary advice which is given is salt restricted diet, and water needs to be restricted if the edema is which is heavy and the urine output is very less. So you need to decrease the amount of fluid intake the child or the person is taking. So for more instructions onto this, you can refer the link that has been given to you. And after having gone through this link, for any queries, you can just post it in the mail. Thank you.